This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, this is Heiko from Acupuncture On Air. Every Tuesday at 11 o'clock on Radio Kidnappers we have a show where we talk to different acupuncturists from all around New Zealand. Today we're going to be talking to Steve Olsen from Auckland. Good morning there, Steve. How are you?
Morning, Heiko. I'm good, thanks. Yeah, thanks for having me on the show today.
That's okay. It didn't have to get you up too early or anything?
No, I've got a toddler, so...
You've been up since 3 o'clock then?
Pretty much, yeah.
But first, we've got quite an interesting talk ahead of us, but just tell us a bit first. I always like to let our audience know sort of how people get interested in acupuncture, what makes them decide to study it, and where did you train and where you're practicing now?
Cool. So I originally got into acupuncture from doing Chinese martial arts originally. I graduated in 2007 from the New Zealand School of Acupuncture and TCM. I was actually more originally herbal medicine that interested me, but I think the more I practiced acupuncture, the more interested in it I became. And I'm currently practicing in Onehunga in Auckland.
Okay. Now, are you working there on your own or with other people? Or
just me and one physiotherapist in the clinic.
Right, okay, that's good. Now, I know that you're the only person in New Zealand that's actually completed the full acupuncture sports medicine certification program in the States, which was organised and set up by a well-known practitioner, Matt Callison. Mm-hmm. How many trips have you actually done to the States, backwards and forwards, to complete this?
8 trips in total. So the program's 4 modules, right. But they're generally, apart from the first one, split up. So you go there, do a couple of days, or anywhere from 4 to 6 days, come back for maybe 4 weeks or so, and then go back again to finish the next part of the module.
Right, well, that must have cost you a house going backwards and there for...
It did, yeah. It was very expensive, but it was definitely worth it.
Yeah.
It's a great program. It's the best I'm aware of in the world of its types.
Yeah. Now, just tell us about one of them. What it might involve in terms of your training.
Well, so you'd go. Typically, the modules would kind of be broken up into the first part and the second part, as I said. So, the first part you'd go in, you'd get broken up into groups. So you'd have one group would do. Just going over the anatomy on each other. Next, and you'd rotate around. The next time you might be doing the motor point location. Another one you'd be doing the cadaver lab, which is very interesting. So there'd be a cadaver specimen, which was an untreated cadaver, which you'd look at. You'd see where you're needling, which was very, very useful. You'd see acupuncture points, motor points, dangerous areas. It was very, very, very eye-opening.
Yeah, doing that and seeing the actual cadavers, that must have really opened up the knowledge, because it's quite different than just like looking at a textbook and seeing a picture of an elbow and the points here, but then actually looking at all the muscles, the tendons, the ligaments, everything there. So that must have really opened that up for you.
It really did. A lot of it looked very different to what it looks like in a textbook. You get some muscles that look quite big in a book, which are actually quite small, and vice versa. Yeah. Just even seeing things like the continuity of the fascia in the body, all the connections of that, which a lot of the anatomy textbooks don't tend to have.
Right. Now, we know that we have traditional acupuncture points and their recognised location, and I think more recently the World Health Organization has actually put out a book where everyone sort of compiled and got together and said, these are the traditional acupuncture points we've agreed. But particularly, I guess, in the last 20 years, there's been like this new knowledge has come out about motor points, and particularly how they're used in the treatment for injuries and musculoskeletal disorders. Can you sort of tell us a little bit about like motor points and what they are and what they're used for?
Yeah, I mean, essentially, it's basically the point where the motor nerve enters the muscle belly. Mm-hmm. So you could almost use it like a reset switch for the muscle. So if a muscle's tight, it can release the muscle. If the muscle's not firing properly, it can activate it. I mean, sometimes you'll find muscles. If you test it, it'll test weak, but it's not necessarily the muscle's weak. It's just it hasn't activated.
Yep.
So, I mean, say needling the motor point for that, you could needle. There's a lot more, obviously, you do in the treatment than just needling the motor point, but you needle the motor point, you retest the muscle, you'll see an immediate change in strength often. A lot of them, some of them are at traditional acupuncture point locations, some of them aren't.
Yeah, so like for example, I know like with tennis elbow, you know, the pain itself is like right on that bone, right on the edge of the elbow there. But then the motor point for it is actually more than in the forearm. It's sort of like...
that's right. So, I mean, that's a good example. So, like you say, that you get the pain on the lateral epicondyle there, and the extensor muscles that all attach on the tendon is typically where you're getting the pain. So I would always, in treating tennis elbow, treat those motor points as they're often... Releasing them or activating them is very important and gets much better results. I mean, you'd also, with the motor points, you'd use the agonist, or often could use the agonist and antagonist motor points. So the opposing muscle, like you have your biceps and your triceps.
Yep.
You know, when your biceps contract, your triceps have to relax, and vice versa. And I mean, it just, you know, it does go in with Chinese medicine's yin yang theory. I mean, very, very much so. It's just a different way of looking at it. But
good. Now, with the it's really good to see that you're getting out there with acupuncture and you know, giving the public this treatment that we can now do for sports injuries, as opposed to the more traditional ways, but. What do you find actually in your clinic? Can you say that you've got one like common complaint that you see a lot? Like, is it sort of like knee injuries from rugby or golfer's elbow, or
quite a lot, quite a variety. I mean, probably like lower back pain would be the most common thing. I mean, probably a lot of acupuncturists would find that. I see a lot of shoulder injuries.
Yeah, but are you find the ones that you're seeing yourself, are they more from like sports and I don't know, rugby or tennis, whatever, or just from lifting up a bag of concrete and hurting your back?
It's a bit of a kind of bit of each really for me. It just depends. I mean, often winter time when they say like rugby and league seasons on, I'd see probably more sports injuries, but it's always about probably half and half. You know, some are kind of just day-to-day lifestyle stuff, some are more sports related, but the sports medicine acupuncture training, it's not just sports injuries. I mean, it applies to kind of just injuries from day-to-day living, overuse injuries, pretty much any kind of orthopedic type injury responds really well to that type of treatment.
Okay. Now how long is it before you're going to become the acupuncturist for the All Blacks, or go over for the Olympics or something? Or are you involved with the local football teams or anything like that?
I'm not. No, I mean, there's some of one of the physios I work with, they did physio for one of the local league teams, so I'd see quite a few of the guys there. I wasn't directly involved, but you still end up seeing a lot of them. I mean, I find in New Zealand a lot of sports teams typically have their own physio. And often the physios will do the very basic dry needling style stuff. So a lot of them will I think a lot of sports teams aren't really aware so much of the difference between what, say, we would do versus the physio doing it.
Right. Now, I have to say, look, from myself and also from our profession, Acupuncture New Zealand, we certainly wish you much success for the future. And helping us establish, traditional acupuncture in combination, with the sports medicine acupuncture, getting out there and promoting that to the thing. So yeah, that's really thank you for that.
No worries. Thank you very much for having me, Heiko.
Yep, and then in the next show we'll talk again, but it'll be a bit more specifically about herniated disc. Yep. So till then, but just before we go, I just want to say thank you again to Ken and Jill, who the two here at the radio station that keep that cog in the machine going. And I've got a song for Ken, and it's called "You're No Good" by Ken Booth.
Who hasn't heard of that song?
All right, thanks, Steve. We'll see you next time.
No worries. Cheers, guys.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.